Hello, my dear friends. Welcome to Aspire 32 again. And today again, another amazing topic, which is very, very rare. And I have Dr. Rajeshwari with me. It's very difficult to get Dr. Rajeshwari on Aspire 32 because it is almost, I think, 2 years since I wanted to do this podcast. But very intelligent with lot of publications. Dr. Rajeshwari recently finished her PhD in Canada, and she was working at KLE Institute of Dental Sciences after her post graduation. She was also working in Manipal Institute, a very prestigious institute in India. Before that, she did her undergraduation and post graduation in periodontics from RV Dental College, Bangalore. But then, as she excelled in her branch, she wanted to explore new things, and she shifted to Canada. And that is why this topic is very rare, because I know that some of you may want to pursue a PhD in Canada apart from that regular licensing thing. So, welcome, Dr. Rajeshwari, to this channel called Aspire 30.
Hello, sir. Thank you so much for inviting me, and I'm so sorry about this wait. This is like a PhD program. It's pretty busy. I'm sorry about that. I'm so happy that I'm on your channel, and then I'm able to reach a lot of people, and then I'm hoping that I'm going to answer most of the questions so that it can help more researchers and the candidates who wants to get into PhD programs or any of the research programs. Yeah.
I completely understand, and that is why this podcast is very important. So, straight away, the first question, Doctor, is you were working in KLE. I remember you joined there, and then you decided that you want to do something else. And then you finally, I came to know that you have applied for PhD in Canada. So, why did you get this thought that why not do some license directly or PR, something like that? Why did you start thinking about doing PhD in Canada?
Well, so when I was working in KLE, that was the first time I actually got exposed to like a basic research. During my MDS, I got an opportunity to work with my supervisor, and then she was guiding me in the thesis project. So that was my first exposure during my PG program. But then once I finished, when I started as a faculty member in KLE, I wanted to do something more. I wanted to learn, add on to my skills. So that's when like I came in contact with a lot of my colleagues in BSRC, because KLE has a centralized research center, which is so beneficial for a lot of students and the faculty members who wants to do research. I think that was the first time I actually got exposure to hands-on when working on the research. I think that's when I kind of got, and then from there I did a project, and then I was working with one of the a couple of colleagues in BSRC, and then that was funded by IDA. And then I think once that project got over, and then with God's grace and all the efforts from the team, and it got published in a pretty good journal, and then I got an opportunity in Manipal. So in Manipal, when you see, I saw that culture even in KLE, a lot of undergrad students wants to do research. So, but then when you see back in our schooling, the research came only in postgrad programs. So that's when I was like, okay, students are very much interested in this. And then I felt like I know some part of research, I am doing research, but I think it's good if I get into a program where I probably get the training. Then I can, be in a position where I can teach my students, because as a part of dental program, I think we were not taught so vigorously. So I think that's when I thought, okay, I have to do PhD, and then that's how my journey started. And then I started applications. Yeah.
Yeah, I completely agree with you because I have also joined a PhD and it's almost at the end now. But I'm sure your PhD in Canada would be, I think I joined more with an, with an interest of understanding what exactly is PhD. But I do understand it in foreign. PhD is definitely something very big, and I also know that you did your PhD under Dr. Anil Kishan, who is a pioneer in the research. So I'm very keen on understanding that how was the process, when you thought, okay, I want to do PhD. Why Canada? That is one question. And second question is, what was the process of getting application? And was it? I'm sure it would be very difficult to get a PhD under Dr. Anil Kishan. So how was this process? If you can tell us in a simple way.
Yeah, sure. So basically, I wanted to do PhD under dentist. That was very clear for me. And then when I'm doing PhD, I wanted to do in top one of the top 50 dental schools in the world. So that's how my homework started. So I started looking at all the countries which have dental schools which offer a PhD program, and then they are in the top 50. So in that, I then try to filter out to Canada, US, and Europe, and Australia and New Zealand, because I was looking at uh, place where I do have an opportunities in later in future. If I want to practice, I need to have that. So then I narrowed down to a couple of countries, and Canada was one among that. And then in Canada, I had applied to UBC and University of Toronto. And it's definitely it's time taking process. Like I think before my supervisor got back to me, it took almost a year before he kind of gave a green signal. So I think if somebody is trying to apply for a PhD program or any research program, I think you shouldn't be disheartened if you don't get response from the supervisor, because they would be getting a lot of applicants, and then there are a lot of factors which will determine their decision to take you or not. So it's definitely time taking. I was working in Manipal, so I kept submitting my applications to a lot of universities, but then my criteria was that I wanted to have a fully funded project. So a couple of universities, they were okay, but then it has to be self-funded, which I was not very happy about it. Like I didn't want to have one of those options. I wanted a fully funded. So I think Canada was a good option. And then Dr. Kishan, he has worked a lot on nanomaterials and then a lot of cellular interactions. And since my previous work was on metallic nanoparticles, that's how I actually approached him. And then yeah,
Yeah,
it
it's quite amazing. I remember you getting a publication. You were so happy. I think when that publication came in a very, I'm sure you had a lot of publications before, but that one publication, it was very significant. I think was
and
a
then
milestone.
yeah, and then it's also kind of little mysterious. That project was on cranberries, and the student who had worked with me for that project, she had actually imported it from Canada, and then
Okay.
I ended up in Canada for my PhD. So it's like it's a nice link. I felt it's
Yeah,
good.
that's very nice to hear. Uh, I get a lot of queries from young students. I'm
Mhm.
sure that you applied for PhD maybe after 4 5 years of your post
Yes.
graduation,
So yes, I
right?
worked in KLE and then in
Then
Manipal, and
you
then
went
I
to Manipal. Yeah, yeah,
yes.
correct. So there are people who ask. I have one podcast from a well-known orthodontist who applied for PhD just after his PDS from Davangere. Do you think is there any chance of getting PhD after dentistry, like a plain undergraduation from India, or you have to be a postgraduate with some research experience? So if you can tell them or something which people look abroad before they
Mhm.
opt you for the admission of PhD, so that the youngsters can work from the beginning.
Yeah, I think I can tell what happened with me. That might be somewhat helpful. So usually, what happens is like when a candidate approach the supervisor, they would be happy if the candidate has a prior research experience, especially hands-on, because they want to see if the I take the student, will the student be independent, and then will he or she be willing to learn new skills, and then are they okay? Like for me, they even the committee would ask you questions, something like that. Okay, you set up a protocol and you tried something and it didn't work. What are you going to do? So I think it's good if the student has a research background. That's good. I think um, I have not come across anybody who has gone directly from BDS to PhD, but then it doesn't mean that there are no possibilities. But then usually when you do MDS, you would have some amount of exposure to research. But I'm sure like these days, even undergrad students do a lot of research work. I think it all depends on the particular person's profile and their experience and their exposures in the research.
Yeah. And I think, there are times like today, now I'm 39 years, and when I look back, there are distinction which is made by us that these things can be only done by postgraduate student. Like for example, you take that. I can give you example in endo itself that special cases should be only done by a final year postgraduate student. But there is no difference between a student who can start it at a first MDS and you can start at third MDS. It is basically the start, and the sooner you start, you have more time at your disposal to understand it better. I think
Yeah,
getting students from undergraduate, maybe at least may eventually lead them for a better opportunities.
yeah.
Of course, that level of thinking may take some time, but it can always help them to think in that way. You said it has to be fully funded. If I have understood you right, fully funded means the research projects, whatever the expenses, everything will be covered by the committee or the organization itself.
So when we say fully funded, usually it's either the supervisor or the school. So every school has a different protocol. So either the supervisor or the school, they will have an channel by which you get stipend, and then also the expenses of all the experiments will be taken care. At the same time, students will also be encouraged to write proposals for funding, external funding. So that way, you don't have to shell out any money from your pocket, even including the tuition fees. Tuition fees is definitely taken care. Yeah, so that's how we say fully funded. But some of the universities, I guess, it would be like they will not receive stipend, or the student has to pay tuition fees. So it all depends on the candidate what they want. If they're okay to pay tuition fees, they can look into that. But then in my case, it was completely covered for the throughout the program. And then also, somebody is fully funded doesn't mean that it takes forever. So there will be certain period of time where the student is supposed to complete the PhD, and they are funded during that period. If they go beyond that period, then they'll have to look in what is next. So,
Of
but
course, it would
generally,
be,
students get to
yeah, I
finish.
completely understand because
Yeah,
all these regulations, everything is followed very strictly at many universities. And I'm sure that they would tell you at the beginning itself that this is all the things which you need to fulfill.
yeah,
But just for an idea, because you had applied for both the types of universities, if it was not a fully funded program, what would be a rough expense? I'm sure it's very difficult to say what would be the expense for the research, but in
yeah.
general, what would be the tuition fees, if you can just say?
Okay. So I think if you go to respective universities, you will get an idea. But then what you need to take care is that check the fees for the international students and the domestic students. So some of the universities or some of the countries, if you have PR, the tuition fees is much less, or if you are a domestic student, it's much less compared to the international student. So for example, University of British Columbia, so if you see, you do get that clear uh, fee structure. So I do not know the exact tuition fees, but
That's
then I can definitely say that it is different for domestic and international students. So I would suggest, like, if somebody is getting to a program which is not completely funded, in that case, I would suggest, like, probably applying for PR would help, so that it's going to be just one third of the international fees. That's going to reduce so much of financial burden on the students. But then, yeah,
so. I think this is quite true because many people also mention this. If you are a
yeah,
PR, you get loan easily
yeah.
compared to a non-PR. You applied without a PR, right?
No,
You
I
and
so mine was an interesting story. So I was applying for PR and the PhD application simultaneously because of the same factor that, like, my fees would be less. But then when I got the admission, and then when I got to talk to my supervisor, and then he explained to me, in University of Toronto, it was fully funded. It's completely based on the merit. So they don't let students pay any tuition fees. But then I had already submitted my PR application. So for me, it just went hand in hand.
you got
So when
PR
I came
eventually.
here, so when I did my interview, I got the admission as an international student. But then when I landed in Canada, they changed it to domestic student.
Oh, you
So
were quite lucky in that aspect.
yeah, yeah, was
Okay.
fortunate.
Um, how like I had another one question which just comes in my mind that you applied for PR that time. I'm sure you had that basic requirements, that English exam,
Mhm.
what was the age, all those things. Uh, do you think if you get a PhD enrollment, getting a
Yeah.
PR is easier?
Yes. So what happens is, one of the factors they assess during the point system is that, do you have any educational background from Canada, or do you have any proof of enrollment, or have you received any admission in any of the universities in Canada? I do not know what is the criteria right now. At least when I was applying, that's what asked. So, but that time I had not received the admission still, so I had put it as zero admission from Canadian school. But then
Okay.
I think it will add on to the points. I think if the system is having the similar eligibility now, I think it should be
Maybe
same.
it will help them. Okay. Of course, the regulations and everything keeps changing, and I request our audience to definitely visit the
Yeah.
website and find the latest information. These all podcasts are generally for your benefit, but things can always change. So, another one thing which comes in my mind is you had applied for PR, but you also got PhD. I hear very little about the visa when it comes to Canada, and people have not told me much about the difference in different visa category. If you got a PhD, would you get a different visa, or you go on the same visa? Because I clearly know in US initially you can go with B1, B2, but when you get a admission, you go on a student visa. Do you have any idea what are the categories of in US, in Canada, visa categories?
Yeah. Yeah, to be honest, I didn't go through that process because I had got the PR, so I never applied for the student visa. So, but then I think, in my understanding, what happens is once you get the admission and everything, you would probably submit that, proof of enrollment and then apply for the student visa. So, but in my case, since I had the PR visa one-time entry, so I was not applying. But then I think the school will support the student in terms of application. They provide, yeah, proof of enrollment, but then the student has to do the work. Like they'll have to proceed submitting the applications, and then if there is any supporting document required to show the student has been enrolled in this program, I think the school will be providing.
Thank you. Um, how was the admission process? Was there an interview? Did you have to visit personally for the interview? Was it online? Was it during the COVID and COVID affected the whole process? Is there something like that?
Yeah, I think so. Unlike other dental programs, PhD program or any of the research program is completely based on your profile. You do not have to give any entrance exam. So here you will have to check respective universities for the deadline, and they will provide what are the requirements, everything. So in University of Toronto, they ask couple of letter of recommendations or reference letters from people who you have worked with in the past, and then you will have to give, of course, because we are not native English speaker, we have to give IELTS exam or TOEFL. So for PhD, IELTS, it is an academic version because IELTS has both general and academic version. So I was supposed to give academic version. There'll be a slight difference in the task in terms of, particularly in terms of writing and reading. So you will have some differences. And then I had to submit the application, and then also you provide all the transcript, which has to go directly from the university to university. Once they process it, then they will have an interview. And every university has a different way of taking students. Uh, what I did was, I think most of the candidates will also do. So they approach the supervisors to check if there are any availability. So they send their CV and then they express their interest, and the supervisor will say like yes or no, and they will say, okay, maybe this is not related to my field, maybe you can try some other university, like that they will say, or they will not respond, or they will respond with some suggestions. That there is one more way is you directly approach the university and then you just submit. So when you get an green signal from any of the supervisor, in that case you can actually write in your cover letter that I would be happy to write the application in such a way that I would work under specific supervisor, because my line of interest and their line of expertise are in similar way. So I would be happy. So like that you can mention, so which is good. Otherwise, what happens when you submit an application? It might go to all the supervisor, and then
You may
it
not get a proper
depends.
specific reply.
It all depends. So but even there, you can definitely mention that
Oh,
I would like to work under a couple of them. But then over there, when you mention a couple of them, they might not even send the application to others. So they will only send to them, or
understood.
so it might. But in my case, I had approached all the supervisors directly, and then once they give you the green signal, I think much better. I think that's what a lot of people have done in my circle, at least.
So there is no specific number of positions available. I don't think there's a clear cut number in each at a given
So,
time.
Here, PhD is all depend on the supervisors funding and if they have positions. So it might be possible that one of the supervisor has so many positions available because he or she would have got funding recently. So another person might have two students. They will be able to take. So it all varies. There is no specific number as such. Unlike other dental program, you have specific numbers for that program. PhD, it's all about whether the supervisor is able to take you or not, provided that they have positions in their lab.
Understood. So once you get the PhD admission, you will start with what are the in our institute, of course the UGC gives the guidelines for the PhD requirement, but then each universities can modify it. Like for example, sometimes UGC says there is no compulsion of publication, but the universities may say that you have to have minimum 2 publication. So what is it like that in Canada? Like, do you have different regulations requirements for PhD completion, or is it given by a centralized unit?
So here in our university, I think it's more of whether you were able to find answers for all the objectives of your research. So that's how it is assessed. At the end of the project, you will have to justify that whatever gap in knowledge you had mentioned in the starting of the project, if you have fulfilled that or not. Again, coming to the publication, it again depends on your supervisors how it works. In our lab, almost every student they finish most of their research papers published before we defend. So in our case it was like, but then I'm not sure if we have a specific criteria that you have to publish all the papers or minimum papers. At least I think it is advisable that at least it is accepted, but then I think it depends on the supervisor and the committee. If they give the green signal, okay, the student has found all the answers or filled the gap in knowledge what they raised in the beginning of the program. But I think particularly the rules and regulations would be updated every year. So I think that it's better if so students look into the program
When they
how
are
it is,
taking
because
admission. Yeah.
when I was taking admission, they don't mention any of these things because it's during the end of the program. But I think personally, I feel that it is better you have all the research projects published before you defend, so that in case the reviewer asks any questions in terms of, okay, can you add this experiment, because there is some dots that needs to be connected. So I think it's good if they have the access when they are in the lab, they publish everything.
How was the PhD? Was it very stressful? How was the duration? Did you start 5 o'clock in the morning and at the 10 o'clock in the night? I'm sure that you have your other responsibilities, right? Travel, your own, work. How did you balance everything, and how stressful it was, or how was it very difficult to achieve?
This so like as I said, unlike other dental programs, PhD is not a 9 to 5 job or not 9 to 5 classes. So it all comes to how you want to set up the experiments. There are definitely times where I have gone to lab around 5 o'clock in the morning, 4:30 in the morning. So I think it's the experiment which demands your attention and then your dedication. So there have been times where I would set up, I keep all the cells ready, and the next day I go and see, and then I don't have sufficient number of cells to work with. Then you just have to wait, and then you do other literature. So I think in terms of time, you will be going to lab. If it's a biological experiments, definitely you will be going to lab. There are no time limits. There, I've gone to, and then also there are some resources. For example, I had to go for imaging facilities where I had to take certain confocal images. You will get appointments around late in the night, 9 o'clock in the night, and then you work because it's a 24-hour service, because a lot of people would be booking the slot. So I think you definitely have to work hard. It's not going to be that easy for sure. PhD overall, it's a pretty busy program. You will have a lot of things to do, and then you will do everything by yourself. It's not like you'll delegate some of the work to someone else, or it's not like how when I was a faculty member. Okay, I'll give some work to others. We share. I think it's not like that. It's pretty busy, and also it depends on your project. So I think the project demands a lot.
I'm sure there would be a lot of expenses, like for example, your stay expense. There would be medical emergencies, medical expense, insurance in foreign countries, which is very, very important. Do you think all these PhD, when you say that it's a fully funded, do they cover all these things? I'm sure there will be some limitation even if they are covering, but does it cover all these things?
Yeah, yes. So we get an annual stipend and then also tuition fees. So the stipend, if you're not having a lavishing shopping and everything, if you have like you can survive definitely. You can have a decent life. And in terms of health, everything, if you are a PR, you do have Ontario or whichever province you are in, you do have the government insurances. And then if not, then you do have university insurances. Most of the time, it is taken care. I think the stipend what they give, you can live with that. It's okay. And then the students are also allowed to work a certain number of hours. I think the government will fix specific number of hours for the domestic and the international students. I think the students can look into that and then probably get a part-time jobs. So you can either work. I think this is true for anybody who comes, no matter it's a research program or the equivalency process. Everybody does a part-time job. I think it is normal, and depending on the availability, you can work. The in my case, I was able to work as an exam invigilator while I was in the program. And then some of the universities, I think you will also have opportunity to work as a teaching assistantship. So, but then it all depends on your program. You will have to check with them how many number of hours you're allowed to work so that your work, the research work, is not getting affected. So I think even without that, you will be able to survive. But then if you feel like you need more expenses
Extra,
because
you can
yeah,
definitely
yeah,
work.
you have to visit your family more often. In that case, you can do
Yeah,
what
like I have a
part-time.
very interesting question here. You left to Canada which year?
2019 September, August. So September I started.
2019. And how till you finished your PhD 2024? How many
Yeah,
times
yeah,
you visited India during this?
twice,
You
twice.
visited twice. Was it very difficult to even find a time to visit India? Because I'm sure if you come on a break, your work also might get postponed or something like that.
Yeah,
Should
I
they
think
leave the dream of visiting their country when they are doing the
not
PhD?
not not necessarily, not necessarily, because what happens here is that you do have a winter break. So most
Mhm.
of the time, students they club their leaves with the winter break, because winter break almost 10 days you get, and then you're probably allowed to take certain number of days or weeks of leave in a year, depending on which university you're working. So people will club and take. In my case, it was totally different. I came and the COVID came, so I was
Mhm.
not allowed to travel at all.
Okay.
Only after like 2 years after my program, then
Things got
I
improved
yeah,
and
and
you
then
were
I was
to.
able to travel. So I think
Mhm.
yeah, you can go. Every university will have specific number of leaves for the students,
Mhm.
and then they can club with a winter break or something like that. They can go. I think you can plan in such a way that nobody will stop you, or it's not like end of the life that oh you have to do everything only then. It's not like that. You can go home.
Mhm.
It's between you and your program director or your supervisor, and how your project is. Of course, not in the middle of an extremely important experiment. If you want to go home for a non-medical or non-emergency reason, that would
Mhm.
be difficult. But then you
Okay,
can go.
fine. So, were there something like, did you get help from any faculty in India, teachers who were like, you said your recommendation letter is important, right?
Hmm?
So, do you think Indian recommendation letters are important, or having a recommendation from in Canada or US, someone who knows you, which has more value in this?
I think if you have worked somebody here, that is excellent. But
Mhm.
then I think one needs to know the candidate well. So for that, they want somebody who has worked in close association with the candidate. So if I have just met somebody in Canada a couple of months ago, but then I've not worked with them, then it's not fruitful if they are giving a recommendation letter. So it's usually good or advisable to take from any of the collaborators or the professors or the teachers whom the student has worked with, or they have known the student's uh, journey very well, where they can provide that positive, you know, input in terms of their academics or research skills. I think that is what
More
is important.
valuable.
Yeah,
More
but then
valuable.
if the student has worked with, or the candidate has worked with anybody from the international, that's definitely going to add more values.
But is it
Yeah.
possible to work up with international? Like so difficult to find collaboration. I don't know unless someone is an Indian who is working, who is okay to partner. Otherwise, everybody hopes to work with people who are abroad. But it is challenging, and not everybody, gets that thought of research very soon. In India, at least, I don't know. It's like many people do it with a compulsion, especially in dentistry. Very less people think research is, is like okay, we'll go with research from the beginning. Don't you
Mhm.
think?
So I think this definitely when the students are in the school, the dental school in India, if they get an opportunity to have a or to be part of the student exchange program, that's where the student gets benefited. When I was working in Manipal, a lot of students used to go to universities like Boston and other universities as a student. It would be just an observership, but then it's all up to the student how they can make a, and then if they can approach any of the professors, and there will be a lot of international summer research programs. Even in the university I worked, there are research programs where non University of Toronto students would used to come during summer, and they used to do a short project. If something is extremely serious and they really want to do, there is no harm. Every university will have summer research programs. They can apply through their school, and then if they get into the program, they get to work with one of the professors here even for a couple of months, and then I think that will add so much of weightage. And then if they are lucky and then the professor feels the student is highly dedicated, even they themselves might provide some opportunities. I think it all about like how they can pick up the dots and then connect and make a story so that they can.
You finished your PhD, and how was the like post PhD experience, and what is the benefit of doing a PhD? I'm sure that you will get opportunities after PhD in US, other countries. In US, if you have done PhD, even your green card is processed faster. That is what is my understanding. People have told me you are at a higher ranking. So, what are the benefits overall you are looking at after PhD? Like, do you want to move to Canada, US? Want to stay in Canada? Or like, what are you looking for?
So right now, no, I'm not moving anywhere. I'm going to stay in Canada. That is the plan. And then here, once you do the PhD, how it works is before you get a faculty position or you're going to apply for faculty position, it is advisable that one does postdoctoral fellowship at least for a year or two. That is to show that kind of leadership skills. You know, you can run a lab by yourself, and then in a postdoctoral fellowship, you will be. Helping the PhD students or master students in their projects like that. But then you will be working under another professor who would be funding your work or who will be paying you. So that's what they expect, and then you can apply for a faculty position. So in faculty position also, over here, what I have learned in this journey is that you have a research tenure and a teaching tenure. So research tenure is usually somebody will have their own lab, they'll get grants. They're primarily focused on the research, and they'll also do teaching. Teaching tenure is more towards the clinical, but then for that, because we are internationally trained dentists, we need to have the Canadian dental license to be eligible to apply for the instructor position or a faculty position if I or one wants to teach in the clinics. So that is one option. And the second option is people do enter industry. Industry doesn't mean to be, it has to be a oral health industry. It can be any pharma industries. People will apply for that job. And then me, yeah, in my case, because like I am dentist, I have an option of either getting license and then practice here, or get a license and then apply in the universities as an instructor, this thing. Or if to have full-time faculty, I think you need to have a master's degree, which is equivalent to the MSc here in respective program or departments. So these are the advantages. And then some, like in my case, things changed. Initially, I wanted to do PhD and then go back to India. But then I'm settling down here. So
Why do you want
I
to
don't.
come back to India? Like what was the reason you
No,
wanted to come back to India?
initially my this thing was to enhance my skills so that tomorrow my students, if they come and ask me questions, and then I should be in a position that I am able to guide them. Yes, I used to do research as a when I was working as a faculty, but then when you undergo a rigorous program, and that's different, right? So that was the initial plan, but then plans changed, and then now I'm settling in Canada. So I'm looking at
Okay.
other options.
Hmm. So I'm sure that option is always there. You can always come back to India. And as you said, you don't have to join dentistry. You can always join the other industries in India. So I think that is always an option here too. I always ask this question because we are all teachers. I'm sure you had a guide, amazing guide. Do you think is there a difference between a teacher here and a teacher abroad? What qualities do you think we should have in us as a teacher, which we lack which you see that in foreign teachers?
I think I've been blessed with great teachers throughout the program, and then even my supervisor is an Indian teacher,
Yeah.
so he's an Indian. So um, I think it's not uh, much of difference I personally felt.
Okay.
Yeah, it's just like maybe in terms of dental and research, the way you look at the project or the way you look at a problem is definitely different when a clinician and when a researcher sees that blend. I got from my supervisor because he was a clinician and then he's also a researcher. So I was glad that I got the blend of that. But I think it's difficult to say the difference between the foreign teachers and the Indian teachers, because here I was never taught by any of the foreign teachers about my dental uh, subjects. So
Understood.
it's difficult to see. But I think apart from that, what I've seen is that we Indian students, we read a lot of books, but then I think here they attend classes and they're good with that.
Okay. It is more theoretically driven here in India. Too much of theory. So my last question to you, it has been amazing podcast, Dr. Rajeshwari. Um, uh, I'm sure you have gone to Canada for many years. What are the things which you miss from India?
Family, definitely. I definitely miss. And I feel distance is a problem because it's two different continent. And then when you want to randomly want to go back, want to see, especially when you have like niece and nephews, and then they're all growing up, and then you suddenly want to go, you cannot go immediately. If you were close, yes. And then I think distance is one thing definitely. Um, that is something, and because you cannot, but then fortunately we can have a video call. We are able to see our family. I think family is one thing. And then in terms of food, no, I don't miss so much because like
You
you
get
get
everything
literally
everywhere. Yeah.
yeah,
How is
in
the
Canada.
weather? Is it like I stayed in Cleveland for a
Okay.
month, so it is very cold. I think it is near to, I don't know, Canadian side. Like it's freezing cold,
Yes.
7 months in a year. It was very harsh. It was harsh initially, but I think we get used to it.
Yes.
Do you think everybody gets used to the Canadian weather, or some
I
people
think
don't like it?
what I have seen is that if a person can survive 2 winters in Canada, they're good.
Very
They'll
good.
be fine. And then the winter will affect you mainly if you're commuting a lot. So in my
Mhm.
case, my school and the place where I was living, literally it was on the same street. So I
Okay.
didn't have to commute so much to the school from my place. So
Hmm.
I didn't get affected so much. But then it all depends on if you're commuting a lot, winter be little harsh on you because sometimes the highest I have seen here is minus 27.
Oh, that's very, very
Yes,
difficult.
yes. But then Canada is very beautiful. You get to see different seasons that you will enjoy
Mhm.
for sure. But then winter is definitely harsh. But
Okay.
as I said, if you sustain 2 winters, you're good.
Winter
You'll
goes for
be
how many months?
so it starts some like peak winter starts from like November. It is like that around till Feb. But again, it depends on which.
Place
province
you
you
are.
are. Yes. If you're
Mm.
in Vancouver, it's more of a rainy place. If it's in
Mm.
Ontario, it will snow. If you go to Saskatchewan, then you have to be very careful because when
Okay.
we have -10, they have -30.
Okay.
So it
That's
depends on which province you are in. But
acha.
I think, yeah.
I'm really thankful that you gave me your time, and it was wonderful talking to you, and amazing to see that you achieved so much. I saw the list of publications, all amazing journals. It is more than, I think 10, 15 amazing journals you have. Very difficult, very challenging.